Welcome back. I want to say a big thank you to NTA and to all the volunteers and people who came to support us during this program. Sickle cell disease is a big problem. I keep on saying it, and I hope you appreciate that. But we believe it has to become front and center of our national discussion. Too many kids are dying. Too many people are suffering from it. So please help us and join us in our fight against sickle cell disease, but more importantly, our fight for good health for those with sickle cell disease. All right, let's get into it. Some important points, again, that I want to remind you about. We have certain disadvantages, in addition to the fact that our genes and our diet. In terms of the healthcare system, we are not yet there. For instance, we have the rate is about 4,000 to 5,000 doctors to a patient or to an individual. In other countries, it's much less. It's much higher than that. In other words, they have like 600, 500, 600 doctors to one patient. So what does that mean? It means that many people are going to be without healthcare, adequate access to healthcare. Not only that, equipment is unavailable, whether it's equipment for treatment or equipment for diagnosis. Obviously, facilities are in short supply. The government obviously is doing a lot, is trying to make up for that, but we're so far behind that it's going to take a long time to get there, unless something hugely drastic happens. So, in addition to that, I'll have a low literacy rates. Drugs are a problem. Having access to safe, genuine drugs is a problem. A lot of fake drugs out in the market. So, and our climate too, we're more exposed to tropical diseases. The climate is, well, in some cases, it allows for certain diseases. In fact, quick thoughts here. I remember many of my patients with sickle cell disease and asthma, they say that for those who have the opportunity to, when they travel abroad, they say they feel better. They don't have attacks as much. Maybe just the environment. I don't know. Maybe they don't have to deal with malaria or typhoid. So the climate is also an issue. I'm saying all these things because these all compound and make it hard to actually live a healthy life. So unless you are intelligent, unless you have the right understanding and knowledge, you will pretty much get sucked on with the tide and with the current, and your health will deteriorate unless, of course, you've got maybe genes from a planet called Krypton, where you're superhuman. But for the most of us, we don't have that kind of opportunity. So we need to know what to do where it comes to our health. And that's why we're doing what we're doing on this show. So I want to quote this. It's going to be on the screen. Health is a large word. It embraces not the body only, but the mind and the spirit as well. And not today's pain or pleasure alone, but, and mark this, the whole being and outlook of man. So health involves the whole being and outlook of man. You cannot just say health is just of the body or just of the physical body. Your mental health is important. Your emotional health is important. Your spiritual health, believe it or not, is hugely important. And we want to take a look at all these things. Now, at this point, I want to mention also that we get a lot of calls and WhatsApp messages and text messages asking us a lot of different questions. Many times, some questions seem to happen a lot of times, like something having to do with the reproductive organs or having an infection down there, and they want to know what to do about it. And let me just quickly point out that we cannot give you specific medical advice over the phone or by text message. You've got to have the tests done. You've got to have the lab tests done and know exactly what kind of infection you're having, and then you can get the right antibiotics and the right medications for that. It would be unethical for myself or for me or anybody else to say go and use this particular medication or antibiotic when we don't know exactly what the disease is. And besides, there are so many calls coming in that honestly, I have to be frank with you, we cannot keep up with them all. My sincere apologies. So for those of you who really want to have a one-on-one, you might have to call to schedule an appointment with us, and we will try and help out as much as we possibly can. So back to what we're talking about. If we're going to be healthy, like I said, we've got to know certain things. There are things that we know we need to do for ourselves, and there are things that the government and the external, the doctors and the nurses and the pharmacists and other players and stakeholders in the healthcare field would have to help us do. So what I'm going to do is I'm going to go to the board and I'm going to kind of like draw out a schematic of it, and then maybe we can show you areas where you fit in. But more importantly, what we're looking for now is that we want to try and get your feedback. Because we're laying out a map for the topics we're going to be treating this year. I already have in my mind an idea of what topics I feel need to be addressed well, but I don't want to leave it to just myself and us, the producers and directors in the studio. We want to say, what do the people want to know about? What is the pulse of the nation, especially where health is concerned. So I want to get your feedback. So as we're drawing this on the board and as we're discussing, just keep it in mind to get a note or something and just write down some of the topics you feel that you want us to address. So I think we'll just take a short break here and then we'll be right back. All right, welcome back. Now, when it comes to health, you cannot ignore the external factors, and I'm just going to go through them in this segment. So the physical environment matters. I've alluded to that a little bit. Hot temperatures, dusty, dry can enable the spread of certain kinds of diseases. And we had the DG of the NCDC, the National Centers for Disease Control, over here, and he explained a few things with regards to that. So the physical environment is very, very important. But let me skip over to this. This is the FMOH, which is Federal Ministry of Health. Of course, they are the custodians of health. The Minister of Health is the custodian of health, and he oversees a lot of what's going on, including the insurance organization, NHIS, and all the other primary health care organizations, the AIDS, the disease epidemic control, a lot of all these things. So he controls, he oversees all that. We will be having him on sometime hopefully very soon. We'll have him on to talk about what his plans and how he sees us going, where he sees us going and the ministry going with regards to health. The climate is important. I've kind of like said that already. Agriculture, you might think that's not important, but absolutely it is. Our food supply and how that food is processed can, to a very large extent, affect our health. I was watching a video on WhatsApp recently and how they are really pumping these livestock, especially chickens, with antibiotics and steroids. We don't know anything about that. Maybe not as much in Nigeria, but hey, if you're bringing in food from out of this country, there's a good chance they have a lot of antibiotics and a lot of steroids in them. These chemicals help them grow. These chickens and these cows grow very big, very fast. It's good for the it's good for the farmers, not good for us. We're not supposed to have all those toxins in our bodies. And by the way, we'll be talking about detoxification, going into it big time. But the food that we eat and the food we get from the market is not as clean as you may think. So we're going to have someone talk about some of these toxins and some of these additives that are added to our foods that you should know about. What else? I mentioned earlier too that healthcare professionals are not, that's what HCP means. Healthcare professionals are not in overabundant supply. We are seriously lacking when it comes to availability of doctors, nurses, physiotherapists, psychologists, and all that. So again, that calls for the importance of you knowing how to take your health in your hands. It doesn't mean ignoring your doctor's advice. It means you knowing about your body, about your brain, and knowing the things that will hurt your brain, knowing the things that will help your body to live healthier and longer. It doesn't just come easily like that. Personally, I had to do, even though I'm a medical doctor, I had to do extensive search to really find out some of the answers to these things, and that's why I'm trying to pass them over to you, or we are trying to pass them over to you. Security, that's a big issue. I was on a TV station, on a TV show, and they said, well, security takes this amount, this percentage of the government budget, food takes this amount, health takes this amount, and of course education takes this amount. And the point was that health and education the budget for health and education was really low compared to security. And they were like, don't you think, they were asking me now, they were asking, don't you think that they should take out of the security budget and transfer to the food, to the health and the education budget? And I was like, listen, my mama didn't raise a fool. My mother did not raise a fool. So, security is paramount. If the borders break down, if this country is invaded and overrun by terrorists, we won't be saying too much about education, and we certainly won't be saying too much about health. We're talking about survival, about refugees, and about all kinds of catastrophes going on. So it's really, really important that security be where it should be given a priority, especially in these trying times that we're in. That is not to say that health, and that is not to say that education are not important, but not to the expense or to the detriment of security. So security is really important. We also need the establishments, the physical locations where people can go to and receive healthcare, their healthcare needs met, whether it's for lab tests. Remember, we need to know what is going on in your body. And everybody treats themselves for malaria. Everybody knows which kind of anti-malaria works. Again, the head of NCDC came over here, and he came to explain that that could be a problem, because sometimes you're treating yourself for malaria. Meanwhile, you have another healthcare condition. It could be an infection that you need to treat rather than malaria. So it's very important that there be establishments where you can have adequate testing done, and that testing be the basis for which you can be treated. Again, these are lacking in this country for many people, especially those in remote areas. So it brings us back down to what we'll be talking about in the next segment, which is what you need to do. And I'm going to point to them when we get back. So don't go away.